Good day, everyone. I'm Dr. Bevin. I head the emergency department at Sakra World Hospital. I would say complaints are to be treated as insights because they all should be evaluated impartially without any judgment in the beginning. And we should take an opportunity to understand whether it is an error-prone pattern that is causing this problem, or whether it is an individual that's causing a problem, or whether it was a perception thing. That said, complaints can arise. And when they complain, sometimes you should take complaints which are arising out of let us say a phenomenon is causing a problem. It may be only known to you by a single complaint that somebody has done. But you should have the patience to basically review the entire process before you hit the individual, or before you touch you go to the depths of understanding whether it is an individual which created the problem or it was like a general phenomenon that created the problem. So you have to continuously review your systems, one. Second is you have to make sure that you have an open dialogue with both parties. So the party that was affected, as well as what you think was the problem or the mistake or a thing. If it is an interpersonal issue, if it is like, often egos get clashed, that happens. There will be some anxiety from the patient's side. There will be some urgency from the doctor's side. And inevitably, when those two things mix, it can just result in an argument, which may come to me as a complaint the next day. So if it does come that way, you have to listen to both parties and you have to try to understand each one's objective is what they're trying to tell. Because in an emotional situation, sometimes the communication may not be appropriate. The communication might be communicating more of the emotions than the actual fact. So you have to help both parties to kind of express each other. Inevitably, they will make their peace between themselves. So that is how most complaints are resolved, because everyone needs a chance to say what they have to say. And that goes for the doctor as well as for the patient. So both would need to speak it out at one particular time and say. So basically, one way of handling the complaint is by dialogue, by listening, by actively listening, by making sure that there is an adequate amount of chance given for both parties to express themselves and both parties to reconcile, and that should close that particular issue. If you think some of the problems are going to be, let us say that some of the problems are going to be solved by just an empathetic ear, yes. But then there will be some which will become big phenomenons. So if there is a phenomenon which is coming out of a single complaint, it is imperative that everything be looked into. If it is a process-related problem, it will start affecting somebody else. So if that's one problem, that sort of problem comes to your desk, then you handle by reviewing the entire process and making sure that everything in that process is now adjusted to make sure that even this exigency is not going to happen. Then finally, I will say that we should always have a no-blame situation. Neither can the complainant be blamed, nor the person who has created the problem be blamed. You got to, as I said again, create an opportunity for a dialogue and understand where it is. And that will also help you if it is not related. If it is a relation to some sort of a skill or an attitude or things like that, then there are other actions wherein training takes over and this and that, which kind of supplements that skill. And in case it is very difficult that it is, let us say that the person primarily has a problem, which is not going to, then we will see whether it is adequately suited for emergency or something else of that sort. No complaint should be neglected and no chance to review the process should be lost, because finally you get better insights from things which have gone wrong. And from that situation, you have to try to improve and strengthen the process further.